So now we're going to discuss the perineum. Now see the diagram. Now this is the image of the pelvic bone. Okay. Now this is the front side, anterior, and this is back side, posterior. Now in the diagram, the highlighted area is the pelvic inlet of pelvis. Now what is the boundary for the pelvic inlet? In the front side, anteriorly, pubic symphysis. Posteriorly, we are seeing sacral bone and specifically sacral promontory. Right, sacral promontory. Now laterally, you are seeing this line, no? I am highlighting this line. Now laterally, this line is called iliopectinate line. So laterally, we have iliopectinate line. Iliopectinate line. Now this is the boundary for the pelvic inlet. Similarly, we have pelvic outlet. See the diagram? Now in this diagram, we are seeing the pelvic outlet, the pelvic bone outlet. Now this pelvic outlet is also called perineum. So what is perineum? Perineum is nothing but pelvic outlet. The outlet of pelvis is called perineum. Main module, very important module for the PG entrance exam. Very often we are getting questions. Minimum 2 to 3 questions we are getting in the exams. INACT, FMG, NEET exams. Okay. Either they give direct anatomy questions or they can club with the relevant surgical and the clinical aspects. Okay. Right. Now see the diagram. Now, I told you the pelvic bone outlet, the pelvic outlet is called perineum. So, next we're going to see boundaries of perineum. Okay. Now, this is front side, anterior. This is back side, posterior. And this is lateral side. Now, anteriorly, same pubic symphysis. Anteriorly, pubic symphysis. Okay. Posteriorly, what bone we have? Coccyx. Very good. Posteriorly, coccyx. Laterally, we are seeing this part. What is that? Ischial tuberosity. In lower limb, we read about the ischial tuberosity. Ischial tuberosity give origin to hamstring muscles. Ischial tuberosity. Okay. And here, this is anterior and lateral. This is anterolaterally and this is posterolaterally. Anterolaterally, we have ischiopubic ramus. Anterolaterally, the ischium bone and the pubic bone, the connecting part, that is called ischiopubic ramus. Ischiopubic ramus. Okay, posteriorly, we have a ligament, that is sacrotuberous ligament, from the sacrum to the ischial tuberosity. So, posterolaterally, we have sacrotuberous ligament. Sacrotuberous ligament. Now, this is the boundary of the perineum. Okay, right. So, next one, we're going to draw one imaginary line connecting the ischial tuberosity of two sides. Can you see that? Yes, we have drawn one imaginary line connecting the ischial tuberosity of two sides. So, by drawing this line, we got two triangles, the triangle in front and the triangle behind. The triangle in front is called urogenital triangle and the triangle behind is called anal triangle. Okay. Now, in the anal triangle, we have anal opening. So, this is anal opening. Now, on either side of the anal opening, in the anal triangle, we have a space. I am shading. Yes, we're going to discuss about this space only. Now, this space is called ischioanal space or ischiorectal space. Okay. So, now we're going to discuss about ischiorectal space. So, ischioanal space, that is a correct name between the ischium and the anal canal, but they are calling this space as ischiorectal space or fossa. Right. So, where is this fossa? This space is present on either side of the anal opening. Either side of anal opening. Okay. Fine. Now, we're going to take the section. We're going to take the coronal section. We're going to take the rectum and anal canal, the coronal section. The diagram will be like this. So, now this is our anal canal and the rectum. So, this is rectum and this is the anal canal. Okay. Now this is lateral side. Laterally, we have lateral pelvic wall. This is lateral pelvic wall. Now, in the lateral pelvic wall, we have one muscle. What muscle? Obturator internus muscle. Lateral pelvic wall, we have a muscle that is our obturator internus muscle. I'm drawing the muscle on only one side. So, this muscle is obturator internus muscle. Now, we have fascia over the obturator internus muscle, and that fascia is called fascia over obturator internus. Very simple. This is obturator internus muscle. Okay. And we have a fascia over this muscle. That fascia is called fascia over obturator internus. Now this fascia split and forms on canal, and that is called Alcock's canal or pudendal canal. That is a fascia over the obturator internus muscle, and that fascia splits to form pudendal canal or Alcock's canal. Okay, right. Now medially we have a muscle. What muscle? Levator ani muscle. Medially we have levator ani muscle. This is the levator ani muscle. Levator ani muscle, it is a part of pelvic diaphragm. Again, we see pelvic diaphragm detail later. Don't worry. Meanwhile, please note, levator ani muscle, it is a part of pelvic diaphragm muscle. So this muscle is levator ani muscle, and we have a fascia above and below this muscle. Now this is the fascia present above the levator ani muscle, and we also have the fascia below the levator ani muscle. Sometimes the levator ani muscle fails to meet the obturator internus muscle. In that case, we may have some gap, and that gap is called hiatus of Schwalbe. So sometimes you may have a gap between these two muscles. Levator ani muscle fail to meet the obturator internus muscle. So in that case, we have a gap, and that gap is called hiatus of Schwalbe. So please write hiatus of Schwalbe is nothing but the levator ani muscle, the gap between levator ani muscle and obturator internus muscle. Again, this space is present very rare only. Okay. Usually, levator ani muscle fuse with obturator internus muscle. Fine. Now, below the levator ani muscle, we have one more fascia, and that fascia is called lunate fascia. This is the lunate fascia, which is present below the fascia over levator ani muscle. Yes. So this is our lunate fascia. Okay. Right. Now, what are the boundaries of the ischioanal space? So ischioanal space boundaries we're going to write. First, complete the diagram. And laterally, we have three structures. What are those? Obturator internus muscle. Obturator internus muscle, number 1. Fascia over obturator internus muscle, number 2. Number 3, pudendal canal or Alcock's canal. Pudendal canal or Alcock's canal. Medially, we have only one muscle. Which muscle? Levator ani muscle. Medially, levator ani muscle. Fine. Next, we have a space above the lunate fascia. Can you see the space here? I'm highlighting this space with yellow color. I'm talking about this space. The space above the lunate fascia, that space is called suprategmental space. That space is called suprategmental space. That space is present above the lunate fascia. Above the lunate fascia. Okay. Right. So now, next, we're going to see the contents. Before that, you have to know some basic points about the pudendal canal. Now, how this canal is formed? What are the contributions for this canal? Number 1, I told you the fascia over obturator internus split and form the canal. Sometimes this canal also coming from this blue color. What is it? Lunate fascia. Sometimes the perianal fascia also splits and form this canal. So this canal is formed by, please write, put on small box. Now we're going to write about the pudendal canal. So pudendal canal, which is also known as Alcock's canal, which is formed by the splitting of fascia over obturator internus muscle or lunate fascia or perianal fascia. Okay, right. Next one. Now where you see this canal? I told you this canal form the which boundary for the fossa? Lateral boundary of the ischial fossa. Lateral wall of, it is situated in the lateral wall of ischio rectal fossa. Okay. Now, again, this canal is present 2.5 centimeter above the ischial tuberosity. 2.5 centimeter above the ischial tuberosity. And this canal is extending from, see the diagram. Now, in this diagram, yes, we are seeing the pudendal canal. Can you see the canal? Now, this canal is extending from where? From lesser sciatic foramen and up to deep space. So this canal is present. It is extending from lesser sciatic foramen. This canal extends from lesser sciatic foramen up to deep perineal pouch. Lesser sciatic foramen up to deep space. Okay. All right. Next one. What are the contents? Contents very simple. Pudendal canal contains pudendal nerve and pudendal vessels. What are those? Internal pudendal artery. Internal pudendal artery. And then internal pudendal vein. Pudendal nerve. Now pudendal nerve in the canal, which divides into perineal nerve and dorsal nerve of penis. In female, the counterpart is clitoris. Dorsal nerve of clitoris and dorsal nerve of penis. Okay. Right. These are the contents of the pudendal canal. Okay. Right. See the diagram. So now we're going to draw the contents. This is internal pudendal artery, internal pudendal vein, and pudendal nerve. Right. So that's all about the pudendal canal. Now we know the boundaries, lateral boundary and the medial boundary of the ischial fossa. Now next thing, we're going to discuss the contents of this fossa. Already we know three contents. What are those? The pudendal canal contents only. The pudendal canal contents, yes, they leave the pudendal canal and they also come to the ischial fossa. Okay. So the contents of ischial fossa, please write. The contents of ischial fossa. Ischio-rectal fossa. Number one, pudendal canal contents. Pudendal canal contents. What are those? Just now I told you, internal pudendal artery, internal pudendal vessels, we can write pudendal nerve. Okay. Number two, inferior rectal vessels and nerve, which supplies the lower part. Inferior rectal vessels and nerve. Okay. So next content, inferior rectal vessels and nerve. Fine. Number three, posterior scrotal vessels and nerve. Scrotum, the counterpart in female is labia majora. So in female, posterior labial vessels and nerve. One last content is our fat. Abundant of fat is present. Okay, why we have so much of fat here? Because that allows the expansion of the anal canal during defecation. Now these are the contents that remember for the ischial fossa. Okay. Now last thing, their communications. What is that? Now this is the rectum and the anal canal. Okay. Rectum and the anal canal. Okay, fine. Now, the skeletal fossa of two sides, they are communicating with each other behind this. Now, the skeletal fossa of two sides, they are communicating with each other behind the rectum and anal canal. So, this is skeletal fossa of one side, other side. They are communicating with each other behind the rectum and anal canal. So, please write ischio rectal fossa communicate with each other. Communicate with each other behind the rectum and the anal canal. Okay. So any infection in any one side of the skeletal fossa, then the infection easily go to the other side because we have a communication. Okay. Right. Now, because of this communication, now what is the shape of this fossa? The skeletal fossa shape is, yes, horseshoe shape. It is horseshoe shape. Okay. So the shape of this fossa is horseshoe shape. So these are the points you have to know about the skeletal fossa. Fine. See the diagram? Yes, this is a diagram we have drawn. Now this is the coronal section of the rectum and anal canal. So this is the rectum part and this is the anal canal. I'm writing as AC. So laterally we are seeing, this is lateral. We are seeing the muscle. What muscle? Obturator internus muscle. And we have a fascia. Okay. And we're also seeing the canal, parental canal, lateral boundary. Medially, we have only one muscle, levator muscle, and we have fascia above and below, superior fascia and inferior fascia. And below the inferior fascia, we have one more fascia, and this is our lunate fascia. Yes, very good. And above the lunate fascia, we have a space. That space is called, very good, suprategmental space. Suprategmental space. Fine. Now, what are the contents? The parental canal contents. So, internal parental vein, internal parental artery, and then parental nerve, content of the canal and the content of the fossa. And we also have inferior rectal vessels and nerve and posterior scrotal vessels and nerve. Okay. So, these are the contents of our skeletal fossa. Okay. So, that's all about the anal triangle. Next, we're going to discuss about the urogenital triangle. Now, for this, we're going to draw one line diagram. Okay. So, for this, you have to imagine the cadaver is in lithotomy position like this. So, cadaver is in lithotomy position like this. Right. Now, we're going to remove layer by layer. The bottommost layer, the first layer you're going to remove is the skin. If you remove the skin, then we have superficial fascia and then deep fascia. The point is, the bottommost layer, the first layer we remove is the skin. Okay. Right. Now, we're going to draw some line diagram and then we're going to discuss the urogenital triangle. So, now we're going to write the layers of urogenital triangle. Now, I told you the bottommost layer is the skin. The bottommost layer is the skin. Okay, leave that. Now, above the skin, we have superficial fascia. If you remove the skin, then we see superficial fascia. Superficial fascia. Okay, fine. Above that, we have a deep fascia of perineum. The green color is the deep fascia of perineum. Above the deep fascia, we have a space, and that space is called superficial perineal space. So, this space is called superficial perineal space. So, this space is superficial perineal space. Superficial perineal space. Now, above the superficial perineal space, we have a perineal membrane. So, this green color is the perineal membrane. Above the perineal membrane, again we have a space. That space is called, again, that space is present in perineum. That is present deep. That is deep perineal space. So, this is deep perineal space. So, I'm writing deep space. Okay. Now, above that, we have superior fascia of urogenital diaphragm. That is superior fascia of urogenital diaphragm. Of urogenital diaphragm. Okay. Now these are the layers of urogenital triangle. So from below, skin, superficial fascia, deep fascia, superficial perineal space, perineal membrane, deep perineal space, and superior fascia of urogenital diaphragm. Now from this line diagram, we came to know the boundaries of deep space and superficial space. Very simple. Now what is above the superficial perineal space? The superior boundary of the superficial space, perineal membrane. Below, deep fascia of perineum. Now what is the superior boundary for deep space? The superior fascia of urogenital diaphragm. Below, perineal membrane. So boundaries are very simple. Usually we won't get any questions from the boundaries. The question will be from the contents only. Now one more point I want to add. Please write, note, we have a communication. Where, sir? In the front side. For the which space, sir? For the superficial perineal space. So please write, note, anteriorly, the superficial perineal space, superficial perineal space communicates with anterior abdominal wall. Please remember this communication. This is very, very important. Okay. So anteriorly, the superficial perineal space communicates with the anterior abdominal wall. Now we're going to add contents. See, contents. See, in male, only one opening is present. What is it? Urethral opening. Very good. Female, two openings. Urethral opening and vaginal opening. Very good. See, female urethra does not have any subdivisions. Okay. So in female, urethral opening and vaginal opening present. Very good. In male, urethra. But in male, urethra have subdivisions. What urethra present in the deep space, in the superficial space? That will be the question. So now we're going to draw a line diagram only and to discuss the contents. So first in the male, so this is a prostatic urethra, membranous urethra, and the spongy urethra, right? So three subdivisions, please remember. So this is prostatic urethra, this is membranous urethra, and this is spongy urethra. Now prostatic urethra, we know, which pass inside the prostate gland. Okay. Prostatic urethra is passing inside the prostate gland, right? Now membranous urethra present in which space? Membranous urethra, it is a content of which space? Deep space. Please don't forget. Okay. So membranous urethra, it is a content of deep space. Next, what about the spongy urethra? Spongy urethra is a content of which space? Superficial perineal space. Please don't forget. Fine. So membranous urethra, content of deep space. Spongy urethra, content of superficial perineal space. Fine. Right. Now we have a muscle. Where, sir? Muscle surrounding the membranous urethra. We have a muscle surrounding the membranous urethra like this. Now this muscle is called sphincter urethra muscle. This muscle is called sphincter urethra muscle. This blue color one. Sphincter urethra muscle. Now sphincter urethra muscle also known as external urethral sphincter. So we're going to discuss about sphincter urethra muscle. So please write sphincter urethra muscle. Now sphincter urethra muscle, I told you, which is also known as external urethral sphincter. External urethral sphincter. Now it surrounds which urethra? Membranous urethra. Very good. Surrounds membranous urethra. In which space? Deep space. Membranous urethra in deep space. Very good. Now what is a function? Actually, this muscle is the skeletal muscle. And this muscle controls the micturition. This muscle controls micturition. So this muscle is skeletal muscle. So micturition is under our control only. Okay. So this is a skeletal muscle. Fine. Now damage to the external urethral sphincter, damage to sphincter urethra. What happens? The patient losing their control over micturition. That is called urinary incontinence. So damage to this muscle results in urinary incontinence. Urinary incontinence. Okay, right. Now in this diagram, yes, we are seeing the layers of the urethral triangle. Now we are seeing the deep space. Now in the deep space, we are seeing membranous urethra, and surrounding the membranous urethra, we have sphincter urethra muscle. Okay, so sphincter urethra muscle, yes, I told you that muscle is the skeletal muscle that controls micturition. Damage to sphincter urethra muscle results in urinary incontinence. Very good. Now see this diagram. Now in this diagram, yes, we're going to discuss. See, I told you we have external urethral sphincter. That means we also have internal urethral sphincter. Now internal urethral sphincter is present here. The internal urethral sphincter is present at the neck of the bladder neck. Okay, so please write internal urethral sphincter. Very important. So many times we got question from this topic. So internal urethral sphincter is situated at the neck of the bladder. Okay. Next point. Now can you see one duct here? I am marking in white color. I am putting a box over that structure. What is it? That is the ejaculatory duct, which is opening into prostatic urethra. Can you see the urethra here? Yes. This is the prostatic urethra. I am writing as PU. Below that, we have the deep space, and that is the membranous urethra. Here, that is the membranous urethra, and this is a spongy urethra. I hope you know that. Now we have one duct which opens into the prostatic urethra. What is that? That is our ejaculatory duct. That is our ejaculatory duct. So ejaculatory duct opens into prostatic urethra. Now ejaculatory duct is formed by the union of vas deferens and seminal vesicle. Now can you see this gland here? That is the seminal vesicle. I am writing as SV here. That is seminal vesicle. So seminal vesicle joins with the vas deferens and forms ejaculatory duct. If you know, leave it. If you want, you can write. Put one box and then write. Ejaculatory duct is formed by the union of seminal vesicle joining with vas deferens. Okay. Now this ejaculatory duct carries semen. This ejaculatory duct carries semen, and this ejaculatory duct opens into prostatic urethra. Opens into prostatic urethra. Okay. Fine. Okay. Now semen is given to prostatic urethra. Now, is there any chance for semen to go into the bladder? Semen given to the prostatic urethra. Now, is there any chance for semen to go into the bladder? No. The entry of semen into the bladder is prevented by one muscle. Which muscle? That is our internal urethral sphincter muscle. This muscle will do that only. So, internal urethral sphincter muscle prevent the entry of semen into the bladder. So, internal urethral sphincter prevent the entry of semen into the bladder. Now this is called, so this muscle prevent retrograde ejaculation of semen. Prevent retrograde ejaculation of semen. Okay. So now, what type of muscle is the internal urethral sphincter? It is not under our control. Okay, so we're not telling the sperm to go above or below. No, it is not under our control. So internal urethral sphincter is the smooth muscle. Okay, right. Next one, damage to internal urethral sphincter. Damage to internal urethral sphincter, that is most commonly seen in TURP, transurethral resection of prostate. That is the procedure we do for BPH. Okay. Right. Now, in TURP procedure, IUS is most commonly damaged. Okay. So in the exam they will ask you, what is the most common complication of TUR procedure? Most common complication of TUR procedure. What is that? Very good. Retrograde ejaculation of semen. Retrograde ejaculation of semen. Okay. Right. So that's all about the external sphincter and the internal sphincter. Very important topic. Very often we're getting the questions. So to sum up, external urethral sphincter, internal urethral sphincter. External urethral sphincter location in the deep perineal space. Internal urethral sphincter location at the neck of the bladder. Now, external urethral sphincter, skeletal muscle or smooth muscle? Skeletal muscle. Internal sphincter, smooth muscle. What is the function of the external urethral sphincter? Controls the micturition. Internal sphincter, prevent retrograde ejaculation of semen. Okay. Now, damage to external urethral sphincter results in urinary incontinence. Internal urethral sphincter damage results in retrograde ejaculation of semen. Right. So, next, that's all about the internal sphincter, external sphincter. Now, we're going to discuss the contents of the deep pouch and the superficial pouch. So, first, we're going to see the contents of deep pouch. Boundaries already we know. Above, superior fascia of urogenital diaphragm, below, perineal membrane. Now, contents, we're going to start with the muscles. Now, we have two muscles in the deep space. What are those? Number one, external urethral sphincter surrounding the membranous urethra. And we have one more muscle. That muscle is present in the perineum, and that muscle is transversely oriented. So that muscle is called transverse perineae. That is present in the deep space. So that is called deep transverse perineae muscle. Deep transverse perineae muscle. So contains two muscles. Okay, what are those? Number one, external urethral sphincter or sphincter urethra muscle and deep transverse perineae muscle. Fine. Next, neurovascular structures. Now, neurovascular structures, first nerve, dorsal nerve of penis. In female, the counterpart is dorsal nerve of clitoris. So, next nerve. So, nerve we have dorsal nerve of penis. In female, the counterpart is dorsal nerve of clitoris. Okay, sir. What about the artery? Artery, the internal potential artery, the three terminal branches. Arteries, the internal potential artery, three terminal branches. What are those? Artery to the bulb of penis, deep artery of penis, and dorsal artery of penis. In female, the counterpart is clitoris. So, arteries we have, please write. Arteries we have deep artery of penis, in female clitoris, dorsal artery of penis, in female clitoris, and artery to bulb of penis, in female clitoris. Okay, right. Now, what are the other contents? These other contents are not same in male and female. Okay. Now, please read the heading, the other contents. In female, we have two openings. What are those? Urethral opening and vaginal opening. So, in female, urethra and vagina. I told you already, female urethra, no subdivisions. But in male, what urethra? Membranous urethra is present. Very good. Membranous urethra. Okay. And we also see one gland in male. What gland? Can you see? Can you see the gland here? I'm putting a box over there. I'm talking about this gland. That is Cowper's gland or bulbourethral gland. That is Cowper's gland. Okay. Or bulbourethral glands. Present in deep space. So in male, we have Cowper's gland or bulbourethral glands. Bulbourethral glands. Okay. Right. So these are the contents of the deep pouch. Okay. Now, what are the contents of the superficial pouch? So again, boundaries we know already. Above perineal membrane, below deep fascia of perineum. In the front side, superficial perineal pouch is communicating with anterior abdominal wall, right? Now, contents of the superficial pouch. First, muscles. We have three muscles in the superficial perineal pouch. What are those? Muscle present over the bulb of penis, bulbospongious muscle. Muscle present over the crux of the penis, ischio-cavernous muscle. And one more muscle, that muscle is transverse, present in the perineum, and a superficial muscle, transverse perineal superficial muscles. So three muscles present in the superficial perineal pouch. Sir, in male, you told these three muscles, sir. What about female? Female also, same three muscles only. Ischio-cavernous muscle, bulbospongious muscle, transverse perineal superficialis muscle. Okay, same muscles in male and female. Right. Next one. Right. So muscles over. Next, nerve. Nerve, we have posterior scrotal nerve. See here, posterior scrotal nerve present in the superficial space. Posterior scrotal nerve is this one. This one. This entire thing is posterior scrotal nerve only. So nerve, posterior scrotal nerve. In female, posterior labial nerve. Now what about the artery? Artery, same. Posterior scrotal artery. Again in female, posterior labial artery. And same, internal pudendal artery, the three terminal branches. The internal pudendal artery, the three terminal branches, deep artery of penis, dorsal artery of penis, artery to the bulb of penis, same. Okay. So next, other contents. What are the other contents? Now we're going to see in male and female, other contents in male and female. Now other contents, first in male, root of penis. Root of penis or root of clitoris in female. Now root of penis is formed by the union of the bulb of penis and the crux of penis. Together it is called root of penis. Similarly, root of clitoris is formed by bulb of clitoris and the crux of clitoris. Okay. So please write contents root of penis. Okay. And what urethra is present here? Spongy urethra. Very good. Spongy urethra present in the superficial space. Okay. What about female? In female, we have two openings, urethral opening and vaginal opening. Okay. Plus, in female, we see one gland. What gland? Greater vestibular gland or Bartholin gland. Greater vestibular gland or Bartholin gland. Greater vestibular gland or Bartholin gland. Okay. Right. So now these are the contents of the superficial space and the deep space. Now, next, see the Bartholin gland. I told you just now, the Bartholin gland, it is a content of the superficial space in female. Now, Bartholin gland through Bartholin duct, which opens into posterior wall of vagina. So please write Bartholin duct, which opens into posterior wall of vagina. Okay, right. Now the patient is having block in the Bartholin duct. So the patient has swelling in which wall of vagina? Very good. Posterior wall of vagina. So please put on box. So swelling in the posterior wall of vagina, which is due to Bartholin cyst. Bartholin cyst. Fine. Now, the patient, a 30-year-old female, she came to gynecology department with the complaints of swelling in the anterior wall of vagina. So in the anterior wall of vagina, we have one duct. What duct? Gartner's duct. Very good. So swelling in the anterior wall of vagina is due to the block in the Gartner's duct. So swelling in the anterior wall of vagina, which is due to Gartner cyst. Gartner cyst. So please don't forget. So the Gartner's duct opens into anterior wall of vagina. Bartholin duct opens into posterior wall of vagina. So swelling in the anterior wall of vagina is due to block in the Gartner's duct, Gartner's cyst. Swelling in the posterior wall of vagina is due to block in the Bartholin duct, which result in Bartholin cyst. So please note the point. Now in the exams, yes, you may get the question. So a 30-year-old female, she came to gynecology department with a complaint of swelling in the posterior wall of vagina. That means they're asking about Bartholin cyst. Swelling in the anterior wall of vagina, Gartner's cyst. Am I clear? So very important point. Please note these points. Okay, right. Now next one, we're going to see one important structure, perineal body. Perineal body. Now what is perineal body? See, perineal body is nothing but it is the fibromuscular structure that is the meeting point of all the perineal muscles. Perineal body, which is present between urinary opening, urogenital opening, and the anal opening. So perineal body, please write, which is present between urogenital opening and the anal opening. Okay, right. Next point. This perineal body receives muscles in various layers, which receives muscle in 3 layers, and thereby which gives a strength to the pelvic organs. Thereby which gives strength to pelvic organs, which gives support to the pelvic organs and prevent the prolapse. Okay? Yes. Next one. Now what are the muscles attached in each stratum? Now in the deep stratum, levator ani muscle, the pubococcygeus part of levator ani muscle. Now with the intermediate stratum, in the intermediate stratum, we have deep transverse perineum muscle, and the deep part of external anal sphincter. External anal sphincter. Okay. Now, what about the superficial stratum? In the superficial stratum, we have bulbospongious muscle, and then superficial transverse perineum muscle, superficial transverse perineum muscle, plus the superficial part of external anal sphincter. So almost all the muscles, they meet at the perineal body, except only one muscle which is not meeting at the perineal body. Which muscle? See the diagram? This muscle, that is the only muscle which is not meeting at the perineal body. What muscle? That muscle is our ischio-cavernous muscle. So ischio-cavernous muscle, it is the only muscle which will not meet at the perineal body. Ischio-cavernous muscle is not meet at the perineal body. Okay, right. So these are the contents of the superficial pouch, and we also discussed about the perineal body. Okay, right. Now we're going to see some more applies. So after knowing the contents of the superficial pouch and the deep pouch, you have to know about the urethral rupture. Now, urethral rupture, we have 2 cases, sponge urethral rupture and the membranous urethral rupture. Now in the old exams, they were asking question directly. The patient is having sponge urethral rupture. What are all the areas the urine extravasate? The patient is having membranous urethral rupture. What are the areas where the urine extravasate? Likewise, they gave the questions directly. But in the recent exams, they are giving some clinical scenarios. From that scenario, you have to identify which urethra is ruptured. Now, what are the clues they will give you for the spongyurethral rupture and membranous rupture. Okay. So for the membranous urethra rupture, membranous urethra rupture is due to pelvic fractures. Okay. So whenever they want to ask anything about membranous urethral rupture, they will give the clue the patient is having urethral rupture following the pelvic fracture. Okay. Right. For spongy urethra, for spongy urethra is rupture is due to spongy urethra rupture is due to straddle injuries. Straddle injuries. Okay. So straddle injuries result in the rupture of spongy urethra, whereas pelvic fractures result in the rupture of membranous urethra. Okay. Please don't forget these two words. Okay. The exams, they'll give these clues only. Fine. Now, the spongy urethra, it is a content of which space? Superficial space. Okay. Membranous urethra is a content of deep space. Fine. Now, what are the areas the urine extravasate in the case of rupture of spongy urethra? See, spongy urethra, that is the one divided into bulbar urethra and the penile urethra. Okay. Right. So now, the rupture of spongy urethra, what are the areas the urine extravasate? Number one, the urine go to which space? The urine extravasate to number one, superficial perineal space. Superficial perineal space. Okay. I told you in the beginning itself, the superficial perineal space in the front side, it is communicating with anterior abdominal wall. So urine also go to anterior abdominal wall. Fine. Number 3. Now here, from here, the urine also come to scrotum. And the urine also collects around the penis. Okay, urine also collects around the penis. So these are the 4 areas the urine extravasate in the case of rupture of spongy urethra. Okay, right. Next, what are the areas the urine does not reach? The areas where the urine does not extravasate. So urine does not go to, not to. Number 1, urine does not go to thigh region. Why, sir? Because of the fascia lata, the deep fascia of thigh. Fascia lata prevent the extravasation of urine to the thigh region in the case of rupture of spongy urethra. Number 2, the urine does not reach deep space. Why? We have one membrane. What membrane? Perineal membrane present between the superficial space and deep space. That membrane prevent the entry of urine into deep space from the superficial space. Perineal membrane. And the urine also does not reach ischiorectal fossa. Urine does not reach ischiorectal fossa. Why? Because of Cooley's fascia. Okay. So urine go to 4 regions. Urine does not reach 3 regions. Okay. So that's all about the rupture of spongy urethra. Next, in the case of rupture of membranous urethra, see the diagram. Now in this diagram, the section taken the coronal plane. Okay. Now this is the bladder. I'm writing a B. And this is the prostatic urethra. And this is the membranous urethra. And this is the spongy urethra. Now, the rupture of membranous urethra, I told you, rupture of membranous urethra due to pelvic fractures. So patient is having pelvic fractures and the urine come to which space? Deep space. Urine come to deep space. Now from the deep space, the urine also go to the space surrounding the bladder and the prostate. I'm talking about this space. That space is called space of Retzius. So urine go to deep space and to space of Retzius. Okay. So rupture of membranous urethra. Rupture of membranous urethra, I told you due to pelvic fractures. They gave this question. 2022 NEET exam, they gave this question. Okay, right. So urine extravasate 2. Urine extravasate 2. I told you, number 1, deep space, and number 2, space of Retzius. Fine. Now, one important point, is there any chance for urine to go into the peritoneal cavity in the case of urethral rupture? Patient is having only urethral rupture. Okay. Now, see the diagram. Now, this is bladder. Bladder is covered by peritoneum only on the superior surface. Okay. This is a peritoneal layer and this is a peritoneal cavity. Okay. Now, the question is there any chance for urine to go into the peritoneal cavity in the case of urethral rupture? No, there is no chance for urine to reach the peritoneal cavity in the case of urethral rupture. Then when the urine will go to peritoneal cavity, sir? In the case of rupture of? In the case of rupture of bladder. Very good. Only in the case of bladder rupture. Please put one box and then write. Only in the case of bladder rupture, the urine reach peritoneal cavity. Okay. So this is very important applied, and very often we are getting questions. Okay. 2023 July FMG exam also we got this question. So they are giving an FMG exam, INCT exam, NEET exam. Yes, in all the exams we are getting questions. Right.